Yes, and I'm James Marin, Integrative Registered Dietitian, Environmental Nutritionist.
We are the co-founders of Married to Health. So Married to Health, as you may know, is all about good gut health. We practice plant-forward nutrition with our patients. We're both registered dietitians, and we wanted to expand beyond that and be able to expand our team. We know that we've seen a lot of patients who not only have gut issues, but maybe also simultaneously are having metabolic disease. And so we wanted to bring someone in who's incredible in that. So we have Vicki Schimmer. We wanted to be able to support those who might have past history or current history of disordered eating patterns. So we have Karina Nava, we have Joseph Bartolone. So we have various specialties on our team. If you're looking for someone to support family nutrition, you can see Karina. If you're looking for someone to really help you navigate that gut-brain connection, we have Joseph. So we love speaking about them, but we also wanted to introduce you to them and start this as the first of many of these lives that we're going to be doing. So we wanted to showcase kind of what we all specialize in. You guys have been watching our lives. We've been talking about SIBO IBS, which is what James and I love talking about. And we wanted to give everyone else kind of a chance to showcase what they're amazing at as well. And this time we wanted you to get to know them.
Yeah. So Vicki, go for it. Can you introduce yourself and tell us a little bit about yourself?
Hi everyone. I hear my echo, but that's normal, right?
I think so, yeah. And tell us, guys, on Instagram if you're hearing an echo, and we'll get this. This is our first shot. We'll get this going. But yeah, let us know if you're hearing an echo on Instagram or anywhere else, and we'll see. But you should be okay, Vicki.
Okay. So it's an honor to be here with James and Dolly and Karina and Joseph. Everything that has to do with holistic and separate and functional is what's close to my heart, because that's the modalities that helped me to overcome my own health challenges. I was young, I was going through a lot of stress, and my digestive system, my gallbladder, my liver were suffering. Mm-hmm. And it was a holistic dietitian who helped me to avoid the cholecystectomy. Mm. And I figured out that that's who I want to be when I grow up.
And for those who might not know, Vicki, what's a cholecystectomy? Because we speak science, right? That's what we do day in and day out. And I think that's why people follow us, right? Because we can kind of translate that into simple layman's term. So kind of bring everyone up to speed of how you got to that point, what a cholecystectomy is, and what were some things that helped you personally?
Right. So I was going through a stressful divorce. I was a young single mom. And my gallbladder gave into that stress, and it stopped contracting and releasing bile for assimilation of fat. So I was unable to eat anything that would be with even, small content of fat. Doctors told me, we have to remove your gallbladder. I was 24, and I didn't want to remove my gallbladder.
Yeah.
And the dietitian told me, she said, give me 2 months to help you and see if we can get this under control. And we did.
Yeah, that's wonderful.
That's what brought me to be where I am today.
Mm-hmm. And we find that a lot, right? I mean, it's like you get, like, no one wakes up, right? I know when I was a kid, I didn't aspire to be like a kale eating, green juice drinking, smoothie making, plant-based registered dietitian. Like, no, 10 or 12-year-old or even 24-year-old is like, ooh, I want to be that person one day. Or maybe when we were 24, yeah, we were studying that, and we're like, yeah, we want to do that. But, as a kid, I was eating Cheerios and cookies and chocolate milk and junk foods every day, not really thinking about it. And it's usually you go down that path and you kind of hit a wall, or you have this like awakening of a moment and go like, oh, wow, what is going on? And I need to understand this and then get that consciousness and make these changes. So that's great. So that usually, like, in our opinion, and I think everyone can kind of agree with this, where, a great health professional is one that really understands the patient, because you were the patient, right? I think we've all been our own patients. We've all been patients of other providers, and that really gives us and instills in us that empathy. So that's huge. And so now gallbladder is fine, right, Vicky? Or how's the gallbladder?
Yeah,
excellent.
where it's meant to be.
And we find that so often with patients, right? Where it's like, I had my gallbladder removed, and that's all it is, right? It's like our human anatomy it's a design flaw, right? We should all just remove our gallbladder because it's a design flaw. We don't need this gallbladder. Like, what does it even do? So yeah, let's just cut it out and remove it, right? That's the root cause. And that's not the case, right? It's like, we need our gallbladder. And once you remove the gallbladder, that's where we come in a little bit more, specialized in the gut, because what tends to happen is now you have this cascade effect of gut problems that then starts to, you've just kind of pushed over another domino, and they're going to keep falling, whether it's months or years or decades, because now you're not releasing enough bile acids, the bile salts, all the things we need to help digest fats properly. And then you go into fat malabsorption, et cetera, and the dominoes keep falling, right? So, yeah.
And as dietitians, that's not to say if it's warranted, you definitely want to use Western medicine when it is, necessary. Like if, your gallbladder had been severely infected, or if it was severely inflamed, that would have probably changed things, but you understood. You weren't there yet. You were probably going down that pathway and you were on that trajectory. But Vicky, you knew intuitively, this is not the path that I want to take. It might work for some, but intuitively you said, I want to keep my gallbladder. I understand its importance. I really want to pursue other lifestyle modifications in hopes to be able to avoid removing my gallbladder. And so with lifestyle nutrition, lifestyle modification, that is something that we work with. We work with our patients. We work with their care team to help them understand, how did this happen, right? A lot of times diagnoses are given, but not a lot of explanation comes behind them. So what was the root? How did this happen? Why did this happen? How can I prevent this from worsening? And what are my options going from here? I'm going to discuss with my care team when medication or surgery or some type of reactive procedure might be necessary. But I'm also going to go into as much prevention as possible. So love that, Vicky.
Cool.
Oh, yeah, absolutely. So that's what I feel it was for me. It was a life-changing event that led me through to another path.
Cool.
Amazing.
Awesome, Vicky. Let's go with Karina.
Yeah, I love everything that you both of you all. And Dolly, you bring up a good point about how it's really case by case. In some cases, you really do need that Western medicine taken. And for me, what sort of sparked my interest in nutrition was when my mom was diagnosed with stage 4 cancer. And I was 14 at the time, so super young, and saw my mom go through these drastic changes physically. She did lose hair, but luckily she's always had a lot of hair, so she never lost all of it. But she also lost a significant amount of weight, and so that to me was just so eye-opening. And her medical team over at Stanford was just incredible. But we also had support from family and friends who were coming to leave home cooked meals and things like that. So that's for me, I started to learn more about, more so I was hearing all these kind of like Mexican traditions, like, oh, try this tea or try this smoothie, and it was all very interesting. Like, how is that supposed to help cancer? But anyway, that got me thinking a lot about that we put into our bodies and how that's supposed to be healing for us. So I love that you touched on that, because that is the case for some people who will need Western medicine. And thank God my mom, after 15 years, she's in really good health, and she won't have to take chemo for the rest of her life, but she's thriving, doing well, and now she kind of leans on me to help her with food and advice about food. So I also wanted to share a little bit about my interest in intuitive eating and also helping families, moms, children who are struggling with body image issues. I feel like that interest really got me going when I started my first job as a dietitian, and seeing a lot of these kids go through dieting measures to change their weight and all this confusion around what it really means to eat healthy. I think for me it was so disheartening to have those
conversations with my patients, or hear those stories, hear all the thousands of diets that they've been on and nothing has worked. And so I just kept thinking about my mom and her recovery and how thankfully she had a good journey and never dieted really. And so it made me feel like I want that for my patients. I want them to understand that food is powerful, it can heal them, and you don't have to do crazy extreme diets. And that's why I love those tough conversations with patients about learning how it is to nurture your body without having this strict dieting or strict rules around food.
Mm-hmm.
Totally.
And Karina, I know I've asked you this personally because you've done advanced education, you've done continuing education in this intuitive eating. And, you know, I think that even as a dietitian, I had questions surrounding it. I wanted to know, like, how does one differentiate between kind of that line of, you know, we all are hearing more about like healthy at every size. When do you differentiate between like, okay, maybe some of these lifestyle habits and these nutrition practices are not conducive to your best health? We want to have an amazing relationship with food. And like you mentioned, you've seen it kind of bud from childhood, infancy, even sometimes with kind of how mom or dad or other caregivers around baby or around that child or around that person might kind of view food or have that relationship with food. But with intuitive eating, I think that there is a fine line, and that's why it takes a specially trained dietitian to be helping patients navigate it, because I have had instances where it's either hearing from other dietitians, hearing from patients who have worked with other dietitians who have practiced maybe healthy at every size or intuitive eating, where maybe that patient needs medical nutrition therapy. Maybe they're not healthy at where they are, or maybe their intuitive eating patterns are not serving their best health. How do you help people navigate that and kind of differentiate between like what's best for their health versus what's best for their mental health around food?
Yeah, that's a really great question, because I think, especially with social media and looking things up about food, it could seem like, oh, just eat anything, eat whatever you want, anytime, all the time. But when I took Evelyn Triboli's course on intuitive eating, who's the author of Intuitive Eating, I really liked the way she presented this whole framework. It's really a journey for patients to learn about themselves and learn about their eating, understanding the why, kind of that root cause, which I feel like is a lot of times when you guys at Married to Health promote, and that's what really attracted me to joining the practice, really getting to that root cause of why are we eating in a certain way, what are some behaviors that are maybe subconscious, and maybe how can we take care of our body in a way that feels good, but also that honors some of the things that we're feeling in the moment. And there's 10 principles that she goes over, and I think it's very individualized, and I like there was this message she talked about, and it was like approaching nutrition with compassion. So being very forgiving with yourself, because eating perfectly or eating a certain way all the time is really far-fetched. There's curveballs. We go on vacation, or maybe we just have a really busy week, and all of a sudden we can't go grocery shopping like we normally do, or cook 5 meals in the week. So she talks a lot about compassion and this framework of being in tune with what you need, and sometimes that means kind of doing some self-assessment and like, what can I accomplish today? So that's what I really enjoy about intuitive eating, getting my patients to get to that point, and very behavior-related things that they can make changes in. And in terms of health of every size, I've just learned some of it through the intuitive eating course that I did with Evelyn, but for me, it seems to be like this big war on how that every size, because yes, there are some physical things that show up with like maybe knee injuries, or yes, diabetes is very prevalent. But for me, what it means is treating my patients equally, no matter what their weight looks like, being a support for them, and also have focus on other factors and not just the number on the scale. Going back to like finding that root cause and what can make you feel better.
Totally.
Very insightful. Thank you. Perfect. And we'll definitely hold additional lives. Like I mentioned, this is just one of many. So we'll be able to do a deep dive into what Karina shares with her patients, her clients, and continue to learn more about each person's specialty. So we wanted to hear a little bit more next about Joseph and how Joseph came about. You guys, I don't know if you know this, but males are like unicorns in the field of dietetics. Like, I think James was one of like 4 males in our entire graduating class in my program. So for us to have 2 males is actually like, this is pretty rare. This is pretty cool here. So we wanted to give Joseph give perspective to Joseph, and we didn't just want Joseph because he's male. It's because he has an amazing insight. He has a great specialty, and he has a really great story. So Joseph, we'd love to hear your story.
Awesome. Thank you. Man, it's every time I hear our team talk, I'm just like, this is how we found each other. I'm just like, yes. But yeah, so yeah, I have a lot of different stories, but mainly as a kid, I was always sick, had asthma, joint pain, allergies, ADHD, like all this stuff that I thought was normal back then. I kind of like stressed out a lot about my diet from a young age. So I was always like, kind of like some of the stuff Karina talked about, like over stressing about diet and all that stuff. And yeah, like eventually, I hit a point in college where I started having issues with my gut. And that really confused me because I thought I was eating healthy the whole time. I thought I was, taking care of myself. Uh, but that was really just the beginning. And it really got me to start looking into like what you're talking about, the root cause of things. So yeah, like I just remember this one time going to the doctor, and the doctor for my gut, like it's having a lot of abdominal pain, like reflux, all this stuff. Sometimes I would even get sick after I ate certain things. Like I got pneumonia one time after after eating certain foods. Like my throat would get so itchy and dry that one time it kind of led into like that pneumonia infection. But yeah, so when I went to the doctor for it, I will never forget this. The doctor, I asked, is there anything like I should do with what I eat to, to maybe help out or anything? She's just like, oh no, like food won't affect it. I was like, oh, okay. I'll never forget that moment. That's when I kind of went like the other way, and I was like, I'm gonna look into this even. Like I was already in school to be a dietitian, but at that point I was just like, wow, like this seems pretty ridiculous to tell someone. Yeah, and then after that on my journey, like I really already followed like a lot of the basic like dietary guidelines and all that. But for me it wasn't enough. And that led me to finding like integrative nutrition, functional medicine, and the focus kind of on the root cause of things. Because like Karina was saying, some people, for them, they stress out so much about diet, and that's the root cause of their issues. For some people, they're not paying enough attention to their diet, and the root cause is that they don't pay attention to what's going in their body, and they need to maybe practice some of that mindfulness and intuitive eating. So like that root cause kind of idea, like really helped me out and really made me want to become a dietitian like that, to where I meet the patients where they're at and kind of find out like, not just like, oh, here's this patient. This is what they're diagnosed with. This is their weight. Oh yeah, they're overweight. They need to lose weight. No, like actually meeting them where they're at, like catching little things like that might have been impacting them from their environment. Maybe they have some food intolerances, just so many things that kind of go past that diagnosis. And yeah, that just like meeting the patients where they're at and finding that root cause really was like a big a big game changer for me, and it helped me out a lot. Like a lot of my digestive issues went away, and to my surprise, like the asthma, all the other things started going away. Like I wasn't even thinking about those things when I started like focusing on my gut health, but all of a sudden like, oh, I have no more back pain, huh? And then like every once in a while when I get some digestive issues, I'm like, oh, the back pain's back. I'm like, maybe there's a link there. But yeah, that was just kind of like a what do you call it? Like a byproduct of me paying closer attention to my gut health. Yeah, and then
Nice.
I love that.
another, like, I guess another huge surprise to me was when, like I did have, I had a lot of anxiety growing up. So when I was going to therapy for that, I was really doing great work with the therapist to try to deal with that. But then when I really noticed a big change was when my gut health and digestive issues started really getting like, solid. Like I wasn't having symptoms every day anymore. It kind of went to every other week. And at that point, like I would notice in certain situations, I'm like, huh, like I'm not even anxious here anymore. Like what's going on with that? So yeah, that was another avenue that was kind of a surprise to me, and kind of what I'm really interested in now, just like how that when you're digesting and your gut is really healthy, it really affects your mental state, your brain health. Um, there's a lot of correlations with pretty much all neurological diseases. People have digestive issues. Uh, and then again, like most people that I've worked at an eating disorder for like the past couple years, and everyone there that has mental health issues has gut health issues. So I just see it so much now. Um, yeah, it's just
Absolutely.
another
Definitely.
avenue that's so interesting to me.
And you're identifying again those roots for some. So identifying kind of that overlap between gut health and brain health and that mind gut connection. And that's why we were so drawn to you as well, Joseph. I think all of us, like I mentioned, have kind of come together in one way or another for the right reasons. But it's seldom that you find someone who just really, really understands that connection and can help a patient optimize, like you were saying with yourself, optimize their care team. So you already were working with the therapist, and just understanding more of that gut brain connection helped you optimize your work with your own therapist. And it's oftentimes when we have gone through our own issues that we're so extremely vested, or someone we love. Karina, you mentioned your mother. Vicky, you went through your own health story. I went through mine. James went through his. We have family members and friends and those who we love who have also experienced their own health changes or health scares or health journeys. And so that really makes you extremely vested. And it makes you, especially as a healthcare professional, even more of a researcher and an investigator. We can all go to Dr. Google when we have something going on, but us as trained healthcare practitioners, we can say, okay, what is credible here and what is not? And then patients understand, like, I know, I stay up to date on Hashimoto's research because I have Hashimoto's. I live with Hashimoto's. Patients can rest assured that I'm not doing these things that, are contraindicated in studies, or things that are not backed by, solid evidence. And, Joseph, as someone who's experienced, that mind-gut connection, he's going to stay up to date on that. Vicky is up to date on metabolic disease. Karina is up to date on that pediatric and, intuitive eating and mindful eating, because she's living it. Karina is a mom. She has an adorable 3-month-old. We're all really living these stories along with those with whom we work. And it creates this passion that we all individually have and has really, really brought us together. And, speaking of, I always kind of like to share, like when we go on podcasts or even we've spoken here before, people always ask us like, how'd you guys meet? How'd you guys, embark on this journey together? And I think that would be fun to share in our last couple minutes. So, I know with Vicky, Vicky and I, we kind of like online dated, if you will, right? We met through like a Facebook group, and I think it was just the, Orange County, integrative holistic coach, something like that. And Vicky and I both connected. We clicked. We shared the same sentiment over something, and then we started chatting, and then we became, we got to know each other. Vicky said, "I'm completing my degree in dietetics. You're a dietitian. We should collaborate. I would love to work together in one way, shape, or form." And when the time was right and we were ready to launch Married to Health, Vicky was one of the first people I reached out to because she expressed that interest, and we just really respected one another. Karina, the three of us, James, myself, and Karina, went to college together. So we completed our undergrad degree together. And Karina and I actually worked together there in college. We worked at what was it called? Student Health Center.
Oh, yeah.
Yeah, the Student Health Wellness Center. And so she and I clicked there. Like, you click with some people, you don't click with some people, you don't stay in touch with some people. And Karina and I really did click. So I graduated a few years before. And then when Karina was ready, she was a dietitian now. She was ready to embark on finding a job. She reached out to me, and we've worked together or around each other in several different positions. We worked together for a pediatrician, and again, just continued to forge that bond, that relationship, really respected one another, kind of saw something different in one another, and then continued for several years. That was 5-6 years ago that we worked together. That was, almost 9 years ago that we've graduated now. So it's over 10 years ago that we met. But we've continued to stay in touch. And again, Karina was one of those first people I reached out to. And with Joseph, it was so funny, actually. I had an intern, a dietetic intern, because we've shared with you all interns and some of our support staff are such an important part of our backbone. But one of my interns shadowing me, understanding that I specialize in gut health, said, "Hey, I went to school with this guy, Joseph. Have you ever made contact with him?" And I was like, no, let me look him up. As we do nowadays, I looked him up on Instagram, and I was like, okay, cool. He seems interesting. And then I happened again to be in a dietitian Facebook group, and Joseph posted something of like, "Hey, does anyone know how to," or something like start up a practice or something like that. And I reached out and I was like, "I do." So we really connected there. So again, sometimes you've had these relationships, we've kind of, forged a new relationship, or have really just respected one another in that way. And here we are.
And I'm excited, and for everyone watching and just everyone here that's part of Married to Health and any health professionals especially, this is what it's all about. It's about advocating first and foremost for yourself and your profession and rising above and always questioning, right? Question the norm. That's how innovation happens. And you're seeking something different. Us here, the people that are here that you are seeing, we are not satisfied with the norm. We are not satisfied with the status quo. We are, that's why it's innovative. That's why it's integrative. And we could say all these other buzzwords, but at the end of the day, it's root cause focus, right? It's root cause nutrition. It's root cause medicine that we're interested in, that we're passionate about. And honestly, that's what we want you all to have in your care team, when you're looking for a health professional, when you're speaking to anyone that's giving you advice, right? They should be root cause focused.
Not gaslighting you, dismissing you. And that is a culture that we have been very passionate about establishing, that, we're here to respect and we're honored to be part of every health journey. And we're very passionate to be supporting everyone with whom we work. And
so, and as we, work with tech and come to you live, wherever you're watching this, it's wonderful. We want to do this more often. We just want to share in this conversation, share in this journey, educate, support, and enlighten. And so we thank you all for watching. We thank you all for joining. And again, thank you to Vicky, Karina, and Joseph for joining and just learning a little bit more. Next time we'll go live on another topic and just discuss it, talk to you guys. And
And this live will
Yeah.
be saved to our page,
Yes.
Married to Health. And drop a comment in there if you really want us to answer or address a question that you have, whether you're watching this on YouTube later, whether you are watching this on Instagram, comment there because we want to hear from you. We want to hear what you want to hear from us regarding our own health perspectives. And we would love to engage with you in that way. We have someone asking, love to hear all your health perspectives. And thank you. And again, it's health perspective. It's advice. And that's oftentimes based on personal education and personal experience. So I'm glad we were able to share that.
But legally, it's not going to be medical advice. It'll be general advice. So we'll keep it very general. But again, sharing that perspective, being in this community has been healing in and of itself, and connecting with really passionate people is healing in and of itself. So we're happy to bring that to as many people as possible. So thank you all. Thank you all. I know you guys have busy days ahead, and hope everyone has a great week ahead.
Does anyone else want to impart any parting words or anything else?
No.
Nope.
Looking forward to those comments, and we'll do this soon.
Great.
All right.
Thank you all so much. Thanks for spending this time with us.
Bye, everyone.
Bye.